It's a disease of the brain, but it breaks the heart. In fact, the odds of getting this condition is not good. Millions are destined to get it. Our program today is entitled Alzheimer's Disease Part 1. We'll be right back. Hi, welcome to Abundant Living, and this is my beautiful bride, Paula Akins. How you doing today, honey?
I'm doing fine, thank you.
Oh, that's great. Good to see you there. And that's a nice blouse, by the way. Is that new?
No.
Okay, you had it for quite some time.
Yes, I had.
Okay, just checking.
Now, we're talking today about Alzheimer's.
Yes.
And of course, I guess people are saying, is it Alzheimer's or Alzheimer's?
Okay, well, let's set the record straight. Today is going to be Alzheimer's. And next week, this is part 1. Now, next week is going to be also Alzheimer's. But now, if you prefer Alzheimer's, then you can say that as well. But we're going to use Alzheimer's in today's and next week's program.
Well, I guess we want to, why don't we first of all define the term Alzheimer's disease? What exactly is it?
Okay. Alzheimer's disease is basically a progression, deterioration of the brain mental function. It affects the neurons or brain cells, nerve cells there. It also affects the axis where the nerves interlock with one another, so that transmission of nerve impulses is interfered. So that's why you have several problems in that area. It can be mild or it can also be severe, just depending on the type, the severity of the Alzheimer's disease and how long the person has had it and diagnosis and that kind of thing. So it's a very progressive disease of mental function.
So I guess we're going to talk about the fact that it can be progressive. It can start at any time in a person's life, I guess.
Well, yeah, we're getting down to the statistics. Usually starts around the age of 65 years of age. But again, as we grow older, of course, it can be more progressively worse as we grow older with age.
Well, and I don't want to get into the stats, but I just want to look at, because I mean, there's times when I lose my keys, I can't find them. I'm going somewhere, I run down the steps, and then I get down to the bottom of the steps and I can't figure out what I'm supposed to be doing, so I run back up the steps, and somehow right in the middle of the step, halfway up, I remember exactly what I was supposed to be doing. So that's the reason why I just kind of threw out at first asking that question.
Okay, well, in that sense, now, if that's true, then about 95% of us have Alzheimer's disease. But Alzheimer's disease is not when you forget where you place your car keys.
Okay.
Alzheimer's disease is where you forget what car keys are used for.
I see.
So there's a difference there. There's a severe mental malfunctioning as far as reasoning and that kind of thing. So it's not just forgetting things, but it's more severe than that.
Well, my daughter always says to me, I'm just too busy. I guess that's the reason why I forget things. But let's talk about then the symptoms of how does a person know that they've contracted Alzheimer's disease?
Okay. Now, of course, an autopsy is the most way of determining whether or not a person has Alzheimer's disease. Now, of course, you have to have brain tissue and looking under a microscope. Well, that's best done when a person has passed. So when a person is alive, a doctor will say you will have probable Alzheimer's disease, about 85–90%. It's not conclusive. But the question is, how can it be diagnosed? Okay, or the symptoms.
The symptoms.
Okay, the symptoms.
Yes.
Okay, the symptoms, well, first of all, sometimes it's first deals with depression, psychosis, because we're dealing with their frontal lobe. So if that's the case, then you have depression and psychosis. Sometimes it deals with the physical outbursts, memory, a lack of visual perception, because it deals with also the hippocampus area as well. So it just depends on where it deals with, depending on what symptoms a person may have. Now again, you have outbursts, you have emotional outbursts, physical outbursts, speech, lack of recall, memory. This is short-term memory, not so much long-term memory. So there's different symptoms that a person does have with Alzheimer's disease.
So short-term meaning something that you might forget, or someone says something to you at that moment and you forget it.
Yes.
Rather than something I might know or someone might know from the past.
Right. Yeah. Most people who have Alzheimer's disease will remember things 10 and 20 years ago,
Okay.
but not 10 and 20 minutes ago, because the memory is not there, because that malfunction of the neurons. That nerve impulse simply is not being transmitted to the next neuron in the brain.
Now, you made this comment about outbursts. You know, there's a lot of people who have outbursts continuously. So what do you mean by the outburst? Is this like something that the person might be in a normacy where they're always okay, and then all of a sudden they act out? Or
yeah, as far as the voice, and also as far as the physical nature is concerned. We'll get more into that part 2 next week. We're going to go right into the brain.
Okay.
We're going to look at 2 of the major hallmarks of Alzheimer's disease by autopsy. But for this week only, physical symptoms are basically outbursts, and we'll go more into that next week. We'll go into the brain and see how that works out.
So how is it diagnosed?
Well, like I said before, autopsy is the most way of confirming an Alzheimer's disease patient. But again, there are several tests that a doctor will take, and sometimes it's based on eliminating other probable symptoms that mimics Alzheimer's disease, such as they will rule out stroke.
Okay.
They will rule out deficiency of B12, because that deals with central nervous system. They will rule out brain tumors, or cancer in the brain, and thyroid problems. They will rule out depression. So what's left is usually, that gives some of the symptoms, is Alzheimer's disease. There are also some tests that a doctor will administer to a person, such as a person who has Alzheimer's disease cannot draw a clock and put the numbers inside the clock, because again, the visual perception. So they can't do that. Counting backwards from 100 by 7. Okay, they have a difficult time doing that. Some people have a difficult time doing that already, but anyway. And counting the word world backwards, all right? They can't really have a problem doing that as well. And if you put maybe a piece of string and a coin in a person's hand, they can't tell which one is the string and which one is the coin. Again, that visual perception. This is the brain dealing with the frontal lobe or the hippocampus, dealing with memory and visual perception. So they have a hard time getting off the exit or the interstate, reading signs. So these are some of the things that are hallmarks as far as diagnosing an Alzheimer's disease patient. Again, this is about 90%, because it cannot be conclusive until an autopsy is done, taking some brain tissue, and then look at those brain cells. But until the person does that or passes on, then they can tell with a certain degree of certainty that a person has Alzheimer's disease.
So there's a battery of tests, then, what you're saying.
Exactly.
And I guess a person, I'm just thinking to myself, what would make me think to even go to a doctor? I mean, is there any kind of pain or anything that goes along with that,
No.
or just?
No. See, there's no pain. That's where the the family members,
All right.
when they start noticing some changes, as I just mentioned,
Okay.
outbursts, depression, they're not themselves. This is a change of personality. So the person is not themselves. So therefore, the family member usually the first one that will detect something's going on with my husband, mother, or whatever the case may be. Because the person doesn't know it, but the family member may pick up on it first, because it's not of their normal habitat. And that's where a doctor needs to go in and check out. And like I said before, they would need to eliminate certain things, because certain conditions can also mimic Alzheimer's disease. So to rule out stroke and depression, thyroid, and deficiency in B12.
What would be the causes then of it?
Well, let's go with the stats first, and then go with the causes. Okay, stats. Now the stats are not good, folks. About maybe 65 to 75 years of age, about 3% of the people have Alzheimer's disease. So it starts from around 65 years of age. Okay. Now, from 75 to 85, it jumps up to about 20%. Now, folks, over 85 years of age, it can be up to 1/2 of people have Alzheimer's disease.
1/2?
Over 85 years of age, from 1/3 to 1/2. So, and that's not good. Now, again, every 7 seconds, someone turns 50, which means that those individuals' parents are now in the 70s.
Right.
That's why, and people are living longer. So, of course, right now, there's about 4 million people have Alzheimer's. At that rate, and people are growing older, by 50 years, it would be quadruple, 14 million. Now, hopefully by that time, we'll be in the New Jerusalem. But as the rate goes according to plan, it's not looking good at all. And so, and then once a person has been diagnosed with Alzheimer's disease, they have about 8 to 20 years of life left. They usually die within 8 to 20 years. So again, 100,000 people, no, 10,000, no, 1,000 people are diagnosed with Alzheimer's disease every single day. 1,000 people.
And so
and the numbers are not getting any better.
So unless the family actually recognizes a difference or a change in their parent or grandparent or whoever's in the household, then basically, and then see to go have a test done. So this is kind of one of those, what do I always use that word, not known or invisible kind of things that can happen.
Well,
as far as since there is no symptoms.
Well, at first it grows progressively worse.
All right.
So you'll notice a change in a person's character and personality, remembering things and how to turn on the oven, how to turn on the microwave, how to brush their teeth, comb their hair. These changes would be first marked, or just not being able to memorize or remember something that just spoken to them, let's say 10 minutes ago. You would cite to them a paragraph, okay, and then ask them to recite as much as they can remember things in that paragraph. A person who has Alzheimer's disease cannot do that, or do it at a very low state of far as reciting whatever you said in that paragraph.
So what would be the causes then?
Okay. The causes of Alzheimer's, now, of course, that can be a program within itself, and it's not conclusive as far as aluminum is concerned, so let's just set that to rest.
Okay.
It is true, though, those who have Alzheimer's disease, once the autopsy is done, there's a high amount of aluminum in the brain. But they're not sure whether or not aluminum caused the Alzheimer's, or because the person has Alzheimer's, that it will retain the aluminum. So it's not conclusive. But there's one common thread that Alzheimer's disease patients do have, and when they do the autopsy, or those who are even alive, they will have a high degree of homocysteines that will be in their blood. This is conclusive across the board. And you can just do a Medline research, just type in Alzheimer's, type in homocysteines. You'll get a array of clinical studies in medical journals about homocysteines in the blood. Now, there are two ways of increasing homocysteines in our bloodstream.
Okay.
Number one is what we eat. There's an essential amino acid called methionine. Now, this comes from animal products and comes from plant-based products. Animal products have a high degree of methionine. Once we take in these foods, methionine converts into homocysteines. Now, the foods that are high in methionine is chicken, cheese, particularly Swiss and Parmesan. Milk has twice as much as methionine than soy milk. So again, these foods, when going into the system, convert into homocysteines, and this is a trademark of all Alzheimer's disease patients. And then, of course, you have high homocysteines level. Another way of having high homocysteines level is, of course, not eating enough of the folate foods. So it's not so much what you eat, but what you're not eating as well. Again, the folate foods will bring down homocysteines. And, of course, we get those in dark leafy green vegetables and also legumes. So, and of course, cigarette smoke, caffeine, and alcohol will also increase the homocysteine level. So, again, there's some other medical journals that I can cite that those who do eat chicken or flesh foods have a high degree rate of or risk of having Alzheimer's disease. Now, just to isolate one clinical study to confirm this, the Boston University School of Medicine, they did a clinical study on 1,098 healthy elderly individuals. They tracked them for 8 years. At the end of 8 years, 111, about 10%, had Alzheimer's disease. They discovered that in those 111, they had a high degree of homocysteines. And this was even recorded in the most prestigious medical journal in the United States, the New England Journal of Medicine, February 2002. But all medical journals will say the same thing, basically high rate of homocysteine levels in the bloodstream. So that's one thing that we can do to cut down on the flesh foods. Again, the chicken and fish, which has a lot of the methionine, which converts into homocysteine once we eat them, and also the dairy and the cheeses as well. I think we have a graphic. Let's go with a summary of how we can also avoid Alzheimer's disease at this time. All right, avoiding Alzheimer's disease. We didn't talk about this, but mental gymnastics. There's been some research in the science medical journal called Neurology, where those individuals who did, let's say, more crossword puzzles, reading, studying, used their brains more actively, had a lower rate of Alzheimer's disease as opposed to those who did not do anything or watched maybe more television. All right. Number 2, a plant-based diet, and we mentioned about that, getting rid of the flesh foods and also the dairy products too. Thereby you get that methionine, but it's not as high as the animal products. And then number 3, the increase of antioxidants. We're going to talk about more about that particular one on the next week's program about antioxidants, how antioxidants will reduce the rate of free radicals in the brain, because free radicals are also prevalent in those who have Alzheimer's disease.
Well, we've talked a lot on the plant-based diet and all that. That's going to be things that we're going to be constantly saying over and over again.
That's
because,
right.
Of course, here on Abundant Living, we talk often about the plant-based diet and how important it is, because it's actually designed by the Creator, God Himself.
True.
All right?
That's right.
And now my next question is going to be about the caretaker, because with all this going on with that individual, that senior individual in the home, what kind of stress, or does it put a stress on a caretaker?
Yes, it does. And right before this program, I called the Alzheimer's Association in Huntsville, Alabama, and I asked her the same question. I said, what is the main concern for the caretaker? Because remember, folks, 70% of people who have Alzheimer's disease are being taken care of in the home, 70%. So I asked her, what is the number one concern for caretakers? She said, is loneliness and isolation. And you can, assume that that would be the case because they're dealing with the person one-on-one. This is 24-hour care, all right? If they've been diagnosed, and they can do brain scans too to see the brain activity, whatever. And so isolation. So we suggest that a person who's caretaking this Alzheimer's disease patient to go with a support group. And let's go to our last graphic and let's highlight this. There are some benefits of support group at this time. Number 1, you will discover available resources. I called her, I didn't know this, but she said there are many Alzheimer's associations across this country. They actually have funds and scholarships for people who can come in and sit with that person for 4 hours so that caretaker can take care of their personal needs here and there when they need to. So it's very good for that. Learn coping skills, sharing information, how to cope with different individuals. And, we have what we call the sundown syndrome, where in the late afternoon is very trying for those who are caretaking the Alzheimer's disease patient. Number 3, also achieving emotional wellness. Caretakers, they go through depression, fatigue and emotional upsets because they may have feelings of guilt and anxiety. So again, support groups are very efficacious for those, particularly with Alzheimer's disease patients, dealing with those. How to write out a living will, a power of attorney. These things need to be in place because you never know that you will need these when the person really gets progressively worse. So that's one great thing that all support groups can give.
Well, I know we're not finished with the subject, so we're going to, this is pretty heavy. We're going to continue this program talking more about Alzheimer's and what's going on with the individual and the caretaker. And I know you're trying to figure out, are we going to cook on this program? And the answer is yes. And, of course, you talked about plant-based foods. So today you want to get your paper and your pencil. You want to ring somebody on the phone and knock on someone's door, let them know that Abundant Living is on, and we're going into the kitchen to make a salad bread bowl with all the fixings. So stay by.
Would you like to learn more about preparing healthful vegetarian dishes? If so, then you want to be sure to order our free Abundant Living resource sheet. It contains useful information about products and cookbooks that will help you to learn more about this natural way of cooking. Along with your order, we would also like to include a free copy of the booklet, The Natural Way to Keep in Shape. This 20-page booklet is filled with tips that will help you to develop a total lifestyle approach to health. To receive both the Abundant Living resource sheet and The Natural Way to Keep in Shape, call us at 800-752-3226 during regular business hours. Call and ask for this special offer today.
Well, we want to welcome you back, and we're going to be doing a salad bread bowl. So we're going to go to the ingredients on this one.
Okay.
It calls for 1 teaspoon of dry yeast, quick rise, and 1/2 cup of water, lukewarm, 1 tablespoon of olive oil, 1/2 teaspoon of honey, 1 cup of whole wheat flour, 1/4 cup of unbleached flour with germ, 1/4 teaspoon of garlic powder, 1/4 teaspoon of onion powder, and 2 cups of spring salad mix, and your favorite salad dressing. Well, we are busy working right here in this part of trying to get this dough ready so you can see how we do it. Curtis is rolling out his dough and I'm rolling out mine, and all we're doing is making it large enough to go over top of a bowl. And you're making one salad and I'm making one.
I need some flour on my roller. Rolling pin. How big
you want to make it large enough to go over top of a bowl. You know, this is going to be a bowl that you can put in the oven. We want to have our oven preheated at 475 degrees also.
Okay.
And at this point, how's yours looking?
I don't know. Should be a little bit bigger or what?
Yeah, it's got to be bigger because I got to go over that bowl.
Okay.
Okay.
Salad bowl. Now this is this can be a 1 meal.
This is a 1 meal, yep, and they're going to see that. Let me just tell you right away that what happened was we took that flour, we had the unbleached flour and the whole wheat flour, we put that together, we had our water with the yeast and water and honey and our onion and garlic powder. We put all that together and made a ball out of it, and we actually put it over there on the side, let it sit for about 5 minutes. And I'm going to show you this now because yours is just about ready, Curtis.
Okay.
You know, you need to have a baking custard type bowl that you can put in the oven. And what I'm going to do is I'm going to actually take a little bit of the olive oil because you need something in your hand to be able to work with this. Just a little bit of olive oil, and you're going to actually use the olive oil. And Curtis, you might want to go ahead and start that. You're going to actually put the olive oil on the bowl.
On the bowl, in my hand.
On your hand, and then put it on the bowl.
Okay.
Okay. And we're going to get the bowl nice and oiled because we got to get that crust off of it, or that salad bowl off of it when we get done. And then all we're going to do is we have that pan over there. And you can bring that pan here, Curtis, and put it right there in the middle of us so they can see what's going on here. And I usually sit my bowl. I'm going to sit mine here. Let's do it the sideways so they can get a chance to see both of them, okay?
Okay.
We're going to sit it down, and we're going to pick up that dough, and we're going to lay it across the bowl. And we're going to pull it around the sides. Make sure. Let's see if you can get that.
Hope it don't stick. Okay.
Okay. We're going to pull it around the sides of our bowl. And it's going to be some real good fixing that's going to go inside of this. And usually what I do, Curtis, I push this up so we make kind of a decoration around the edge of it. You want to make sure it's secure around the bowl. Okay. Remember now, it has yeast in it. So you want to make sure that there's no loose ends on it. How about that? That looks good, Curtis.
Okay,
now, sometimes I just do little scallops around the edge by just taking, putting your hand in there.
Oh, I didn't know what
and making a little decoration in the middle.
You call this a scallop, huh?
Yeah. Okay. And then what's going to happen is it's going to go in the oven and bake. And we bake it for about 5 minutes at 475 degrees. And then when it's finished, you're going to see what the product looks like. But what we're going to do is we're going to take our break because when we come back, you will see the finished product. So stay by.
Would you like to learn more about preparing healthful vegetarian dishes? If so, then you want to be sure to order our free Abundant Living resource sheet. It contains useful information about products and cookbooks that will help you to learn more about this natural way of cooking. Along with your order, we would also like to include a free copy of the booklet, The Natural Way to Keep in Shape. This 20-page booklet is filled with tips that will help you to develop a total lifestyle approach to health. To receive both the Abundant Living resource sheet and The Natural Way to Keep in Shape, call us at 800-752-3226 during regular business hours. Call and ask for this special offer today.
Well, we want to welcome you back. Okay. And we've made our salad bowls. We actually cooked it in the oven at 475 degrees for about 5 minutes. It got brown on the outside. We want to bring it out and cool it off. And then it comes right out of that custard dish real easily. Okay. And then what we've done is we've added in our spring salad.
Spring salad. Now, what we have all the veggies or what?
We've got salad vegetables in there with the bitters and
green peppers.
Red radishes are in there, cabbage and all kind of stuff. We got tomatoes.
Now, honey, I see some chicken here. Now, of course, this is a vegetarian program with Red Bean, so What's with the chicken?
Well, this is not chicken at all. Believe it or not, this is just actually tofu.
No, so I might have known.
So you know it's tofu.
This is tofu.
So it's just tofu. And also, of course, I said I had a surprise for Curtis, and I didn't want him to know what it was.
Because this salad is really not complete.
The reason why I didn't finish it really is because of the special thing I have in here under my dish, which I really didn't want him to see at all.
Oh, the olives. Now we have a salad.
If I had have shown him these, they would never have been on the end of the show. So
let me help you.
We're going to put some olives on this salad as well. You can put a couple of olives on, Curtis.
Why don't you just give me the can and you take this?
No, I don't have the can with me.
What happened to the can?
I destroyed it.
Destroyed it?
Uh-huh.
Oh, why did you do that? Okay. You know, this would probably look better with black olives too, huh?
It probably would.
Yeah. Do you have some black ones too?
No, I don't. Go ahead and just put those on there.
Okay.
And
the rest of these are mine?
No, you want to put them on the salad so they can see how it looks. And you could do
that's
the
what I'm
black
saying.
olives. You can do also the green olives as well to give a little bit more aesthetics to the salad itself.
Now, you have one more olive than I have, so we'll take this over here.
Now, you know, it's very, very funny because guess what? Not too long ago, some friends of ours came to visit with us, and they were out in California. And they came by, and you're not going to believe this, they brought us a case of green olives.
A case, a whole case.
And mainly because they said they were thinking about Curtis and how much he loves olives, and you all know how much Curtis loves olives. Everywhere we go, we have cooking classes, people bring Curtis a can of olives as a gift, and we use them in the class, okay?
We sure do.
We don't want him to eat the whole thing on his own. Now, on top of this also, we've also added any kind of favorite salad dressing you might have. We have quite a few of them in our books as well, that you will drizzle then on top of your salad.
Now, what's this you have
This is
here
just,
now?
just one of my favorite dressings that I actually use on this one, and it's going to be drizzled on top.
Just drizzle.
And you want to remember that you can actually eat the entire thing, the whole salad.
So now you can eat the salad and also the container, the dough too.
That's right. Eat the dough and
crust and everything.
Yep. How about putting a couple spoons on yours?
Now you want me to just drizzle or just pour?
Yes, go ahead and drizzle some across there.
Okay.
All right. And not all of it. And you can, and it's going to soak down, but because of the fact that we had that bread bowl, it's got that, it's not going to soak through the bread, by the way, okay?
Because it's pretty thick, isn't it?
Now, I know that because we're coming toward the end of this program, that I know what you're going to do. You're going to ask me a question. So you know what? I already got him taken care of, okay? And that is that I made him his own little salad bowl that we can go out of the show.
Okay, wait a minute. We got a problem because this one is smaller.
It's smaller because we're going out on the show, and I don't want them to actually, we don't want to destroy the big ones yet, okay?
So this is mine.
That's ours. Okay?
Okay.
All right. Well, you know,
now,
we want to make sure that you stay by because there's a part 2 to this program, and so you don't want to, you know, want to tell your friends and them to tune back in again.
Remember, next week is going to be Alzheimer's disease part 2. We're going to talk about herbal medicine and things that we can really reverse Alzheimer's disease. It's going to be very powerful. So, as always, Jesus said, John 10:10, I come, that they might have life and have it more abundantly.